Thank you for joining us for today's update on COVID-19 in North Carolina. Today, we're reporting 6,951 confirmed cases, 427 people in the hospital, and 213 deaths. Each one of these deaths represents a family in mourning, and we're praying for all of them. There are other families waiting outside hospital rooms as their loved ones fight for their lives, and we continue to pray for them too. Today I want to share some information about a new executive order and some information about the budget proposal we have been working on with the General Assembly this week. As of today, our state has sent almost $580 million to over 257,000 people who have filed unemployment claims since the start of this pandemic. The Unemployment Security Commission continues to make improvements in its filing process and call center, but more work must be done, and it is being done. We know that this virus is taking a toll on our economy and on our workforce, and we can't lose sight of how this virus is impacting our families in North Carolina. I've signed a new executive order today to help furloughed workers whose employers have paid them a severance or a furlough payment. Before this order, these employees were ineligible for unemployment compensation. With this order, they now qualify. We're working with legislators to try and codify into law this order and my other orders on unemployment benefits. Next week, when the General Assembly returns, we hope to get consensus on more help for North Carolina. We also know that our economy, working people, and small businesses, and state and local governments need financial help. Our team is compiling recommendations for how we can allocate the first share of federal money that has come down to our state from Washington. We will have more of that plan to share later this week, but today I want to outline some of the significant items in that budget proposal. General Assembly leaders and I agree that we need to make more funding available to help support our small business owners. And we'll do that by providing funding to the Rapid Recovery Program through the Golden Leaf Foundation, which is already up and running and can act quickly to get funding to people. Small business is the lifeblood of our economy, and many of the men and women who have built these businesses are struggling right now. We owe it to them to help keep them afloat until it's safe to begin easing the restrictions. This money now is particularly important in that the federal small business money has been depleted. Our budget proposal has three broad areas of focus. First, immediate public health and safety, like testing and tracing. Number two, schools and other core state government services. And number three, small businesses and local government assistance. Virtually every aspect of our society has been impacted by this pandemic. That has meant lost revenue and increased needs for many parts of our state. In addition to the small business help, I'll recommend funding for more personal protective equipment and cleaning supplies, as well as more contact tracers who can track the spread of the virus, school nutrition to make sure children are still getting healthy meals, support for local governments and underserved communities, assistance for public schools as they teach online, and more. We've been working with the General Assembly and their staffs, and we're hopeful that this funding proposal can be a consensus effort. I look forward to sharing more details this week as we go along. And as we move through another week battling this pandemic, I want to again thank the frontline workers. You're making tremendous sacrifices to take care of our families and ensure that we can be healthy and safe as we stay at home. We are deeply grateful for the work that you do every single day. Now, I know that many people are frustrated, restless, anxious, and eager to get back to work and school. I also know that many people want to make sure that their families are as safe as possible from this virus. I and my coronavirus task force, which is made up of business, health, education, and other leaders, are getting input from around the state as we prepare the plans to ease restrictions, protect the public health, and get our economy moving forward. Let's keep looking out for each other. And right now, staying at home is saving lives. With me today is the Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, our Emergency Management Director, Mike Sprayberry. Our sign language interpreters are Valerie McMillan and Brian Tipton. Behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. And I will begin with Dr. Cohen.
Thank you, Governor. I want to start today by recognizing that it's Medical Laboratory Professionals Week. While we should always have some cause to recognize our lab professionals, I think it's fair to say that North Carolinians may have a newfound understanding for just how vital the work our lab workers are doing to help our state's health and well-being. I must call out more than 200 folks who are working in our state public health lab right now. They have gone above and beyond these last few months on behalf of all of us. Clinical and public health laboratories may seem hidden from sight, but I want you to know we see more than ever that your contributions are making a huge difference to our health and safety. You are the heroes who wear lab coats, and we celebrate each of you. Thank you. And I want to shift gears now and again shine a light on the disproportionate impact COVID-19 is having on the African American communities. African Americans make up 39% of COVID-19 cases and 37% of its deaths. Yet African Americans are only 21% of North Carolina's population. I want to assure you that these disturbing trends have not gone unnoticed by me or by my team, and they must be addressed. We are dedicating our teams to this work and tapping into the expertise of stakeholders across the state to identify ways to reverse these trends. In addition to ramping up our outreach and education efforts, we also have a team focused specifically on increasing access to testing. We know that as we are expanding testing capacity, that these sites need to be in places that are trusted and easily accessed by our communities of color. Health disparities and health inequities did not begin with this pandemic, but what this pandemic has done is shine a bright light on the long-standing structural biases and inequities that impact our health outcomes. We must look at ways that our current health system may be continuing to reproduce these inequalities and work to build a stronger and more equitable health and human service system that works and improves health outcomes for everyone going forward. Lastly, I also want to take a moment to thank North Carolinians. Whether you're staying home to protect your grandmother, or that friend of yours with asthma, or your neighbor with diabetes, you are saving lives. What we do now determines when and how we can ease our social distancing policies. Keep staying home to save lives. Thank you.
Thank you, Dr. Cohen. We'll now hear from Mike Sprayberry, our Emergency Management Director. Mike.
Thank you, Governor, and thank you for your leadership. Good afternoon. This is day 43 of the State Emergency Operations Center activation for the COVID-19 response. The mission to source and obtain personal protective equipment continues. We're continuing to prioritize the healthcare organizations, congregate care settings, and public safety agencies at risk for COVID-19, but the supply chain delays are continuing. We have received another shipment from FEMA of personal protective equipment in the last week to support our healthcare systems, and we continue to partner with our local emergency managers and healthcare partners to validate ongoing PPE needs. As we see increases in our congregate care settings, specifically long-term care facilities, we are pushing increasing amounts of PPE to support those agencies as well as first responders. Yesterday, we delivered shipments to 66 counties. Gowns continue to be the item in shortest supply, and that seems to be an issue nationwide. We're continuing to place new orders and receive new supplies of various items daily. Tomorrow, the National Guard begins its mission to support the state's food banks. About 40 personnel and 15 vehicles will be deployed to each of the state's 7 food banks to assist with warehousing, forklift operations, and distribution of food to agencies that serve seniors and to school nutrition programs. That's a total of nearly 300 North Carolina National Guard personnel and more than 100 trucks supporting food bank operations across the state. You may see these trucks and National Guard members as they are out making deliveries later this week. The Food Supply Chain Work Group continues to meet every day and is closely monitoring the situation at North Carolina's poultry and pork processing plants, which are critical to both the state and the nation's food supply. This work group is also coordinating with a wide range of government and private sector partners to identify gaps in the food supply chain and to find ways the state can help mitigate those gaps. Please continue your generosity in supporting our state's food banks as they provide for the growing number of people who need groceries. Visit feedingthecarolinas.org to find a food bank near you. You can make a financial contribution or a donation of shelf-stable goods. Thank you for following the stay-at-home and social distancing guidelines. Your actions are flattening the curve and keeping this event manageable for our healthcare system, public safety agencies, and other essential functions. Please continue to follow all state and local stay-at-home orders and follow social distancing protocols. I join Secretary Cohen in thanking all of our medical lab professionals who are working tirelessly in both public and private labs. You are among the many heroes of this pandemic, and we thank you. In closing, as always, don't forget to look out for your friends and neighbors and call your loved ones daily. Guarantee you they'll appreciate it. With your help, we'll get through this together as one team, one mission, and one family. Thank you, Governor.
Thank you, Mike. Thank you for mentioning the food bank. A lot of people are doing significant work to get food to people, so thank you very much for that. My wife, Kristen, was there volunteering this afternoon. We'll now take some questions from the media, and if you can give your name and your organization, we'll take the first question.
Our first question is from Rod Baxley from the Fayetteville Observer.
Hey, Governor, this is Rod Baxley from the Fayetteville Observer. Can you tell us what food processing facilities have been affected? We saw reports of outbreaks at plants in Bladen, Lee, and Robeson counties, and I've heard safety concerns from employees at the Smithfield Foods plant in Bladen County.
We have talked to business leaders regarding the food supply chain and particularly what's happening with poultry and hog production. I know that people are very concerned about employees that are working there and making sure that we continue to protect the food supply. Dr. Cohen, I don't know, that's probably your question regarding what specific plants.
Sure, thanks very much. As you know, the food processing industry is highly regulated and that work is overseen by the Department of Agriculture. So as we have been responding to COVID-19 across the state, we're working closely with our agriculture partners as well as the leaders at these various processing plants to make sure that they have the information, guidance, and support needed to do the things that they need to do to make sure that their workers are protected, as well as keeping these plants running. I know it's been a very collaborative effort, but one that we are definitely paying very close attention to. I've spoken with the leaders of a number of the plants myself to make sure that they had the support that they need from both our local public health as well as state. So I know folks are working very hard to make sure that employees are protected, as well as the plants continue to operate so that they can supply the appropriate food for our state and our nation. Thanks.
Next question, please.
Travis Fain, WRAL.
Yeah, hi, thank you. Travis Fain with WRAL. A two-parter, please. Number one, have we posted any new jobs for public health employees who would do contact tracing? So have we posted any of those new jobs? And second, how many tests do we need to do a day versus what we have the capacity for now in order to take the next step towards reopening?
So first, we know that we need to increase the workforce on contact tracing, and we have formed some partnerships to do that and are working to get employees who are trained in how they do that. And I'll let Dr. Cohen talk about that specifically. This week, we plan to lay out the trends that we need to meet along with testing and tracing capacity in order for us to be able to ease restrictions. We are working with our coronavirus task force. Right now, for example, the president's plan that was sent out in federal guidance requires a 14-day reduction in COVID positive cases. North Carolina does not meet that criteria. It also requires testing and tracing in order to be able to meet that threshold. And what we're doing is looking at all of this as a whole and going to make determinations on the range of goals that we need to hit in order to ease restrictions. And we want to do that. We want to ease restrictions on the economy and on families, and we know that hitting benchmarks in testing and tracing and on trying to drive a downward trajectory on COVID cases along with COVID-like illness as is provided in the federal guidelines, along with our testing capacity, is important. And I'll let Dr. Cohen address that as well.
Thank you, Governor. Yes, on the tracing capacity, I want to remind folks in North Carolina, we're very lucky that North Carolina has a long-standing infrastructure to do this kind of work through our 85 local health departments. We have more than 250 folks who are already trained to do this work and have been doing it since the start of this pandemic and well before. They continue to do that work. Our first effort was also to mobilize further folks within our local public health teams that may have been working on other kinds of disease outbreak, make sure we're mobilizing them all for this effort. And then, yes, we want to ramp up our workforce as well, so there will be more coming on that. We want to be establishing one partner for ease of ramping this up very quickly. So we're looking to establish that with one partner who will then be able to start the process of hiring, recruiting, training, and then deploying folks as we go. Thank you.
One other thing, in my conversation with the Vice President on yesterday, he mentioned about federal contact tracing teams through the CDC. And I know that the CDC is also working with us, and so we hope to get some additional federal help to help us with contact tracing. Next question, please.
Liz Schlemmer, North Carolina Public Radio.
Hi, Governor. Thank you for your time. I wanted to ask, does your administration have any response to the protest against stay-at-home orders? Several hundred people were in downtown Raleigh today. And I also, as a follow-up, wanted to ask if there were any arrests, if that's known.
this global pandemic is an extraordinary situation, and we've taken swift, sure steps in order to flatten the curve in North Carolina and to keep our hospitals from being overwhelmed. I'm glad that we did that. I think that we have saved countless numbers of lives. I also know how frustrated and anxious people are about wanting to get back to school and wanting to get back to work. And at the same time, I know how anxious families are to make sure that they are safe from this highly contagious virus that can take lives. We are working to ease restrictions in a responsible way, in a staged way. We'll be bringing forward this week more specifics on that plan to move forward and what trends, testing and tracing that we are going to be looking at in order to begin the process to ease the restrictions. We understand that stay at home, we can't stay at home forever, and that this is not something that is sustainable long term. But what we have to do is to ease back into it to make sure that this virus does not spike, which it very easily could do, overwhelming our hospitals. You only have to look on TV at what's happening in New York and Italy to see what could happen here. And we have modeling that shows what can happen if we just remove the restrictions and say everybody go back as you were. I think most everyday North Carolinian understands that we have to approach this responsibly with public health and safety, saving lives at the forefront, but also understanding that we do need to ease restrictions in order to cushion this blow to the economy and to work to get more people back to work and people back in school. We're going to have to do it in a new way because this virus is going to be with us until we have a vaccine. So we have the potential, when we ease restrictions, of seeing the virus continue to attack people and continue to increase. So we have to keep that balance and we have to be smart about it. And I think the people of North Carolina want us to rely on science and data and facts and consultation with our business community who are actually out there wanting to protect their employees, wanting to be doing more to help contribute to the economy. And I think it's going to take all of us pulling together to do that the right way. Next question, please.
Kate Martin, Carolina Public Press.
Hello, Governor and Dr. Cohen. This is Kate Martin with Carolina Public Press. There's a question that Travis asked that I don't know if you guys got to. He asked, how many tests do we need to do a day versus what we have the capacity for now? And I'm also interested in more information regarding the contact tracing. It sounds like you guys are working with a private company to hire these workers. Are there any other details that you can share regarding the number of workers that we will need across the state to increase contact tracing, how much money they're expected to make, and that sort of thing? There's a lot of out-of-work North Carolinians that I'm sure are paying great attention to this.
Well, first, we want to do as much testing as we can, and our testing work group is working furiously to ramp up testing as much as possible. We have 14 labs in our state. We have lab capacity. We're working to get more personal protective equipment, and we're working on getting that number up, and we're over 80,000 tests being run now. But we're going to, this week, talk about the ranges where we need to be in numbers of tests and our testing capacity as we lay out how we want to move forward in easing restrictions. So we'll get you something more specific as we lay out the plan this week. And Dr. Cohen, you may want to talk about contact tracing or add to what I've just said.
Thank you, Governor. So not much more to add because we do not yet have the partner that we're going to be working with in terms of ramping up the contact tracing. That is something that we're working on this week. I hope by end of this week or by early next week that we'll be able to share more information as well as start to recruit folks to be part of that workforce. As I said, we already have 250 folks and growing to do that work, and our teams are estimating now the kinds of numbers that we think we might need to get to in order to do the tracing we think is necessary to go forward. Thanks so much.
Next question.
On News and Observer.
Hi, thank you for taking our questions. I've got two questions that are related. You mentioned the General Assembly coming back next week. That's a week from today, but the stay-at-home order expires a week and a day from today. Why not let people know now so they can prepare if businesses will reopen or if it'll be extended or opened? And then also related to that, the House COVID Education Committee meeting is Thursday, and they're supposed to talk about calendar flexibility. So is there any guidance that you can say when you'll make that call for schools also? Thank you.
Thank you for those questions. First, we will be announcing this week as part of our plan moving forward and our efforts to ease restrictions. We'll be making an announcement regarding the executive orders that are in place and set to expire at the end of the month. There will be an announcement soon regarding schools. Our public health team is looking at what is needed in order to be able to make sure that children are safe at school. We're talking with the school superintendents, with the State Board of Education, with the Department of Public Instruction about the art of the possible and what kinds of things we could do to make sure that we would keep children safe. And we'll be making an announcement probably this week as well regarding schools and what we're going to do. Right now, we've got them closed until May 15th. I'm very proud of our teachers, our cafeteria workers, our bus drivers, people who are continuing to strive for remote learning for children, continuing to provide them hot meals. And I appreciate the parents. I know the parents are so frustrated to have their children at home and not getting the kind of education they would want to have. I think that there are a lot of good things going on out there, but nothing substitutes for being in the classroom and learning. And a lot of our efforts are going to be working toward a goal of getting toward a new normal where we can feel safe with our children in school, but getting them there as soon as we can to make sure that they can get quality education. And I'll say to you that this week we should be having announcements on both of those things. Next question, please.
Alma McCarty, WFMY.
Hi there, Governor. This is Alma McCarty with WFMY News 2 out of Greensboro. My question has to deal with unemployment. So I wanted to see first, has the Division of Employment Security really tripled its staff? Are those folks who are now hired, are they actively working or are they in training? And has this helped the influx of calls and claims filed?
So there is a significant amount of work going on right now, and I had about a 2-hour meeting yesterday pushing the Employment Security Commission to be able to handle the calls that are coming in and to be able to help people to get their unemployment compensation faster. A significant amount of money, I gave the figure earlier, I can't remember exactly what it is, but millions of dollars have gone out to tens of thousands of claimants, and more are filing every day. They've got a significant crush where you look at a normal month before this came about was about 12 to 13,000 people claiming unemployment. The past month, over 650,000 people, so they immediately had to ramp up. They should be over 1,000 people by the end of the week in their call centers. People are working to go through training. They're working more to do more automation. People are able to file their claims because we have close to 700,000 claims that have been filed now. A lot of people are calling the call center in order to get the status of their claim. We want to make sure that people can get an answer to their questions and that we get this money out to them as soon as we possibly can. We're pushing. We'll get you specific numbers on that soon, but I know that they are working to be able to handle these calls and to be able to get these claims paid as quickly as possible. Every single claim that's filed represents a family that may be hanging by a thread, and they need that money as quickly as possible. And I'm glad that they've gotten a significant amount of money out, but they need to do more, and they need to do it faster, and we're going to continue to do that. I'm glad also that the executive order that I've signed today will allow more people to claim unemployment compensation, because before, people who had gotten separation payment or furlough payment would not have qualified, and this executive order will allow them to qualify. So there's a lot of work going on to try to make sure people get this money. That's good for the families that need it. It's also good for our economy, putting this money into the economy right now. Next question, please.
This will be our final question. Andrea Blanford, WTVB.
Hi, Governor. It's Andrea Blanford with ABC 11. This is a two-part question about how COVID-19 deaths are being counted and how that data is tying into how much PPE we're asking for and able to get. So last week, Secretary Cohen said we still don't have a definition for when someone recovers from COVID. So how is the state defining a COVID death? If someone tests positive for the virus and then dies, are they getting counted as having died from COVID? And then we've been hearing from the state that there is still a shortage of certain types of PPE. And Governor, you're still asking the federal government for more, I know. But from what we've heard from our major hospitals, UNC, Duke, the Wake County Health Department as well, they have enough right now. So who doesn't have enough, and how do the COVID case numbers and stats tie into how much we're getting? Thank you.
Yeah, well, thank you for that question. I'll answer the second part. A number of our hospitals and medical systems do have enough because everybody's been working so hard to try to provide it for them, and we're pleased that that's the case. But there are a lot of other medical providers that are short, and we also don't have enough personal protective equipment for our first line responders, our law enforcement, our firefighters. There are a lot more than just the people who are conducting tests, because still the testing requires people having PPE. So there's still a lot of PPE that we need to cover all the people that should be covered, and we're continuing to scrap and work every single day, not only to try to get help from the federal government, but we've made lots of orders across the world to try to bring PPE to North Carolina. There's always a problem with masks. Surgical gowns is a big problem right now throughout the state, and we're working on that. But I'll let Dr. Cohen take the part about COVID deaths, and then Mike, if you wanted to add something about PPE, you could.
Sure, thanks. Quickly on COVID deaths, those are deaths that are determined related to COVID-19 by our medical examiners, and yes, it's usually a COVID positive test prior to someone passing, but we can get you the specifics on how our medical examiners are determining that. And again, we have a team of those that are both at the local level and the state level that do that work. And you're right on the recovery piece. We certainly know folks are recovering from COVID-19. We have requested assistance from the CDC partners in helping us define how do you decide recovery. That is something we haven't seen anyone define, and we don't want to start all all of us starting to define that in different ways. So that is something we're looking for guidance from the CDC on, and hope to be able to share that back soon when they give us some additional guidance there. And I'll just add on the PPE front for healthcare providers that yesterday was one of our biggest days we saw of requests for personal protective equipment from our nursing homes in particular. So while certain places and our acute providers may now be having better access to PPE, we still know that we have pockets of concern, and I'll turn it over to Director Sprayberry.
Thank you, Dr. Cohen. And the governor's right. We do have a lot of PPE for our healthcare systems, but those aren't the only places that we're trying to get PPE for. And to be totally clear, gowns are a shortage in our healthcare system, so we're still aggressively seeking to buy more of those. And as Dr. Cohen mentioned, we have to look out for our long-term care facilities. And as the governor mentioned, we also have to look out for our agencies at the county level, our first responders like firefighters, police, and others, to make sure that they all have personal protective equipment in order to keep them safe as they're on the front lines of this pandemic. Thank you.
Thank you for everybody for being with us. We'd ask you to stay safe, stay at home as much as you can, and we'll be back with another briefing tomorrow. Thank you.